this video we are going to look at the stages of the arousal, as well as the sleep. So to start off with questions, the first question we want to ask is, in case of the alert wakefulness, what is the EEG finding? So what is the EEG finding in case of this? The second question is in case of the relaxed drowsiness. So here, what is the EEG finding? The third question we want to ask is, in case of the NREM2, what are the EEG findings? So in this video, you will find the answers to all these questions, and in the end of the video, there are some bonus questions as well. So to start with, we look at firstly the alert wakefulness. So what is the alert wakefulness? So firstly, looking at the behavior, so we are going to divide it into two categories. One is the behavior, another is the EEG findings. So to start with, the behavior, it is awake. The individual is awake, it is alert, as well as the eyes, if you see, it is open. The next one is the EEG findings. The EEG, there is the beta rhythm. There is beta rhythm which is seen, that is 14 to 30 hertz. Next what we see is the relaxed wakefulness. So in terms of the relaxed wakefulness, the behavior is that the individual is awake and is relaxed, but the individual, if you see, has the eyes closed. Then we move on to the EEG. So looking at the EEG, my relaxed wakefulness. So here it is mainly the alpha rhythm. So it is basically the alpha rhythm, and it is about 8 to 13 hertz, if you see. And there is also change. This changes to the beta rhythm. It changes to the beta rhythm. So in case of change to the beta rhythm, so when does this change occur? So if you see, there is what we saw is there it changes. It changes to the beta rhythm. This is when in response to the internal and external stimuli. Then we look at the stage of relaxed drowsiness. So relaxed drowsiness. So in such a stage of relaxed drowsiness, the behavior is that the individual is fatigued. There is fatigue, as well as the individual is tired. Then what other thing happens is that the head, if you see, it droops, the head droops, and there is momentary lapses of the attention. Next, it is also the individual is sleepy. The individual is sleepy and not asleep. Sleepy and but it's not asleep. The next we look at the EEG. So what is the EEG finding? EEG finding, there's decrease in the alpha wave amplitude. The decrease in the alpha wave amplitude as well as the frequency. Then what we move on is the NREM1. So what is the NREM1? So this NREM1, it is about 5%. So here the behavior is that there is light sleep, and it is the person is easily aroused. So the thing is, the individual is easily aroused, and this is by doing by a moderate stimuli. and also even by the muscle jerks, Next, it also continues, there is continuous lack of awareness as well. There's continuous lack of awareness as well. Then if you look at we saw the behavior, now going on to the EEG. So in case of the EEG, it involves the mixed frequency waves. So it involves the mixed frequency waves. That is, it predominantly, it is 2 to 7 hertz. Predominantly 2 to 7 hertz. Next, we look at the gap in the alpha rhythm. There is gap in the alpha rhythm, and this is filled with theta. It is filled with theta, and this is from 4 to 8 hertz, and also delta and delta. This is nothing but it is slower than 4 hertz activity. Then there is also something known as the vortex waves. There is something known as the vortex waves. Next, we move on to the NREM2. NREM2. So NREM2 is nothing but it is about 50 to 60%. So here we are going to look at the behavior. So in case here the behavior is that there is a lack of sensitivity. There is lack of sensitivity as well as sensitivity to the activation and arousal. Next is there is also a predominant theta activity. There is predominant theta activity. This is about 4 to 7 hertz. Next, if you see, there is the K complex. The K complex and the sleep spindles. The K complex and the sleep spindles, it occurs periodically. So they are nothing but the EEG findings. Now we move on to the NREM3. So NREM3 and 4, we are going to do it together. So NREM3 and 4, it constitutes about 15 to 20%. So in case of this NREM3 and 4, so this occurs during sleep. That is during deep sleep. During deep sleep, and the arousal only with vigorous stimuli. There is arousal only with vigorous stimuli. And there is other thing to notice that the sleep arousal, if you see, it is the most difficult. It is the most difficult. Then we look at the EEG finding. The EEG finding of the NREM3 and 4 is that there is something known as the delta. The delta is greater than the theta, activity. Next, we move on to the REM. What is the REM? So REM is nothing but it is the paradoxical sleep. So this involves about 20 to 25%. So what is the behavior of this patient? The behavior is that there is about 50 to 90 minutes. There's 50 to 90 minutes. This is after the sleep onset. And then there are also episodes. There is episodes which are repeated. Episodes repeated. And this is repeated every, you can say, 60 to 90 minutes. And each episode, so one episode will last for about 10 minutes. So other important thing is that the dreaming, if you see, the dreaming, it occurs in this phase. Dreaming occurs. And there is also the rapid eye movements which are seen. Then what we see is there is an increase in the brain oxygen consumption. There is increase in the brain oxygen consumption. So there is severe increase in the brain oxygen consumption. So what is the EEG finding of this REM? So the EEG finding is that it resembles that of the awake state. So it is similar to the awake state. Other thing is that there is a sawtooth waves are present. There is sawtooth waves which are present. So now we'll go back to answering our questions. So the first question we asked was, in case of the alert wakefulness. So in terms of alert wakefulness, what is the EEG finding? So the EEG finding is nothing but there is a beta rhythm. So it is for 14 to 30 hertz. Next question we asked was, in case of the relaxed drowsiness. The relaxed drowsiness. What is the EEG finding? So in case of the relaxed drowsiness, it is the decrease in the alpha wave amplitude and as well as the frequency. The next question we asked was, in case of the NREM, in case of 2. So here, what is the EEG finding? So in case here, the EEG finding is that it is predominantly theta activity, that is 4 to 7 hertz. And there is also K complex. There is K complex and the sleep spindle. K complex and the sleep spindle occurs periodically. The K complex and the sleep spindles occurs periodically. Now we'll move on to our bonus questions. So we are moving on to our bonus questions. So the first question, you can answer these in the comments. So the first question we want to ask is, in case of relaxed wakefulness. So in case of the relaxed wakefulness, what are the EEG findings? This is first one. The second one is, in terms of NREM1, what are the EEG findings? Third question is, in case of the NREM 3 and 4, what are the EEG findings? So you can answer these questions in the comments.